Charlotte Perkins. Gilman was 26 years old. She had just had a child. She was a writer. Her doctor was Dr. S. Weir Mitchell, the most respected specialist in nervous disorders in America. His patients trusted him completely. The medical establishment trusted him without question. His prescription for Charlotte: complete bed rest. No reading, no writing, no intellectual activity of any kind. She was to lie in a room and do nothing. She followed it for 3 months. She said afterward that she came within 3 months of losing her mind entirely. She did not have hysteria. She had a life she was not allowed to live, a mind she was not allowed to use, and a doctor who had given her condition a name that medicine had been using without serious revision for 2,000 years. The word came from the Greek hystera, uterus. Hippocrates named it around 400 BC. His theory: the uterus was a wandering organ. When it drifted from its proper position and moved through the body, toward the lungs, toward the throat, toward the brain, it produced symptoms wherever it settled. Breathlessness, trembling, irrational emotion, fainting. This was not fringe medicine. This was the foundation. Taught in schools, recorded in texts, passed from one generation of physicians to the next, with the same confidence given to any established fact. The wandering womb theory was eventually abandoned. By the 19th century, no serious physician believed the uterus was physically mobile, but the word stayed. And more importantly, the assumption the word carried stayed with it, that women's bodies produced symptoms their male counterparts did not, rooted in something specifically, essentially female. The diagnosis was not incidentally female. It was definitionally female. A man could not be diagnosed with hysteria. The word would not allow it. Fainting, nervousness, insomnia, fluid retention, irritability, loss of appetite, outbursts of emotion, excessive sexual desire, insufficient sexual desire, a desire to be left alone. These were the documented symptoms of hysteria as recorded in 19th century medical literature. Not from a single fringe source, they appeared in variations across mainstream medical texts throughout Europe and America for the better part of a century. In 1859, physician Frederick Rillier published a definition of hysteria that cataloged 75 distinct symptoms under its umbrella. A woman could qualify with almost any combination of them. The list contained its own contradiction. Too much emotion and too little emotion were both symptoms. Too much appetite, too little, wanting company, wanting solitude, any behavior that made a woman difficult to manage medically qualified. The diagnosis did not describe a condition, it described inconvenience. By 1900, some doctors estimated that 1 in 4 women in the Western world had it. The math should have asked a question. It didn't. The room had yellow wallpaper. Dr. Mitchell's treatment was called the rest cure, complete bed rest. Total isolation from any stimulating activity, no reading, no writing, no correspondence, no work of any kind. Women undergoing the cure were force-fed rich food to build up what physicians described as depleted nervous tissue. The medical theory behind this was not informal. It was published, cited, and taught. The female brain, doctors argued, if overused, diverted blood away from the reproductive system. Intellectual exertion was not just inadvisable for hysterical women, it was the cause. Charlotte followed the rest cure for 3 months. She documented precisely what happened to her. She came within a hair of complete psychological collapse. She eventually abandoned the cure, returned to writing, and recovered. She wrote The Yellow Wallpaper, the story of a woman confined to a room, prohibited from working, slowly driven to madness by the walls around her. Published in 1892, still in print. Dr. Mitchell reportedly said the story had done him harm. The cure nearly destroyed her. The work she was forbidden to do is what saved her. For women whose hysteria presented as physical tension rather than emotional disturbance, the recommended treatment was different. physician-administered pelvic massage, performed until what medical journals of the time recorded, in clinical language, as hysterical paroxysm. This was standard practice, documented, billable, conducted in medical offices across Europe and America throughout the latter half of the 19th century. Physicians did not object on ethical grounds. The objection that appeared in medical literature was practical. The treatment was time-consuming. It required sustained manual effort. It fatigued the physician. By the 1880s, the first electromechanical device was developed specifically to address this problem, a labor-saving medical instrument. It appeared in professional medical supply catalogs before it appeared anywhere else. The Sears catalog carried one by 1902. The advertisement described it as a remedy for nervous disorders. The treatment was not considered sexual, it was considered medical. That distinction tells you everything about who was defining both words. The device invented to save doctors time treating a condition women didn't have is still sold today. The condition it treated is gone. If you've ever had a physical symptom dismissed as emotional, subscribe before we keep going. Because the next part of this history is the one that was photographed, documented, and put on public display. And the comments on this video are already filling with women who recognize exactly where this story ends up. Paris, 1878, the Salpêtrière Hospital. The Salpêtrière was not a small clinic. It housed 5,000 women, the poor, the mentally ill, the epileptic, the chronically sick, and the hysterical. All of them under one roof. All of them under the care of Jean-Martin Charcot, the most celebrated neurologist in Europe. Sigmund Freud would later travel to Paris specifically to study under him. Every Tuesday, Charcot held public demonstrations. Doctors attended, artists attended, writers, journalists, members of Parisian society. The women patients were brought out, hypnotized, and posed in positions Charcot had named and cataloged. The Arc de Cercle, the Crucifixion pose, the Attitudes Passionnelles. He published a 3-volume photographic atlas, the Iconographie photographique de la Salpêtrière. The women's faces and bodies documented like specimens in a natural history collection. The women who performed best received better treatment, more food, more comfort, more of the doctor's attention. The diagnosis had created an incentive structure. The women performing Hysteria for Charcot's audience had learned quickly what a hysterical woman was supposed to look like. He had shown them. Not every woman diagnosed with hysteria was dramatic. Some were simply inconvenient. Alice James was the sister of Henry James and William James, one the most celebrated novelist in the English language, the other one of the most influential psychologists of the century. Brilliance ran in the family. Alice had it in full measure. Everyone who knew her knew it. She spent most of her adult life as an invalid, diagnosed at various points with neurasthenia, hysteria, nervous hyperesthesia, confined, treated, managed. The specific diagnosis shifted. It was always located in her, never in the world she had been given. Her diary, kept privately, never shown, not published until 40 years after her death, recorded what was actually happening. "I used to sit immovable reading in the library," she wrote, "with waves of violent inclination suddenly invading my muscles, taking some one of their myriad forms, such as throwing myself out of the window." She called it moral prostration, the body's protest against a life too small for the mind inside it. She died at 43. Her brothers got careers. She got diagnoses. In 1952, Hysteria was quietly removed from the first edition of the Diagnostic and Statistical Manual of Mental Disorders. There was no formal announcement, no reckoning, no review of the cases that had been built upon it for a century. The word simply did not appear in the new classification system. The reason was not that medicine had proven hysteria wrong, it was that the category had become too professionally embarrassing to defend publicly. The science had not changed the diagnosis, the optics had. Women who had been institutionalized under that diagnosis received no reassessment, no new hearing, no acknowledgement of what had been done in the name of it. The condition did not disappear, it was renamed. Conversion disorder took its place, the same core framework, different vocabulary. Physical symptoms explained by psychological cause, applied still predominantly to women. Freud had already performed his own version of this decades earlier. Hysteria became the foundation of psychoanalysis. The symptoms reframed as repression. The word changed. The patient's credibility did not improve. They didn't cure hysteria. They retired the word. The word changed. The pattern didn't. The history of dismissing women's physical symptoms under a catch-all emotional diagnosis did not end when hysteria left the textbooks. It continued under new vocabulary: anxiety, psychosomatic presentation, attention-seeking, drug-seeking. The conditions that came after, endometriosis, POTS, lupus, multiple sclerosis, were each, at various points in the 20th century, placed in the same category hysteria had always occupied: symptoms without a clear organic cause, in a female patient. The conclusion drawn the same way it had been drawn for 100 years before. The patient was still the problem. The body was still the explanation. 2,000 years. One word. Then another. Then another. The diagnosis kept changing. The woman being dismissed stayed exactly the same. Has hysteria, or something that replaced it, touched your family's history? A grandmother, a mother, maybe you? Drop it in the comments. Because the stories there are the continuation of everything this video just named. And if you think this history deserves to be told properly, subscribe. There's a second part to this story, and it starts much more recently than you'd think.